These amazing women who are about to welcome to the stage, Senator Kirsten Gillibrand and Christy Turlington Burns, have propelled their missions to achieve ongoing global impact. Both women are incredible leaders in their fields who have thrown all their passion and purpose behind helping women to succeed and excel in a world where we know that sexism remains an urgent issue. Every year, more than 300,000 women die from maternal-related causes around the world, and 98% of those deaths are preventable. Model and social entrepreneur Christy Turlington Burns made the documentary film No Woman, No Cry in 2010 to raise awareness around maternal fetal health. And following the release of her film, she founded Every Mother Counts, a campaign dedicated to providing scalable, high-impact maternal health solutions for countries around the world. Senator Gillibrand has long been a fierce champion of women's rights. She's been consistently committed to protecting our access to the full range of reproductive health care and has spoken passionately on the need to retain the Affordable Care Act. Her support for reproductive rights has earned her a 100% rating from the National Organization for Women, Planned Parenthood, and NARAL, Pro-Choice America. She's also been a leader calling out sexual harassment and assault since long before the Me Too hashtag. I admire both these women tremendously, and I'm very glad to be welcoming them to the stage. Please help me welcome Senator Kirsten Gillibrand and Christy Turlington Burns.
Hi, everybody.
Hello, everybody.
Woo! It is a pleasure to be here with you all to talk about women's rights and the importance of women's health and access to quality and respectful health care, as well as the plight of the working mother today. I first met the senator when she was still a member of Congress about 10 years ago and very pregnant with her second child. And at the time, I was advocating on Capitol Hill for global maternal health. That's my job. And she was this incredible representative, like fully embodying what we were talking about in the room, which always makes the conversation that much more meaningful. And because she was in that state, I feel like we always just immediately connected as mothers first. But we have a lot of other shared interests and passions. So I'm delighted to be here with you. But let's just get right into it, okay?
Thank you, Christy.
You're welcome, thank you. I'm really interested in talking about what's happening right now, as we all are, right? Washington is taking a certain stance on women's health, and there are some individuals who are being considered for very important positions, and that's going to continue to impact us as well as the important laws that exist now to protect us. How worried should we be?
So right now the big debate is Judge Kavanaugh. He's been nominated by President Trump to be the next Supreme Court Justice. And the reason why we should care is because he intends and will overturn Roe v. Wade. President Trump was very clear that his intention of the 25 judges he named as potential justices was to overturn Roe v. Wade, and Judge Kavanaugh's record shows that that is what he will do. He not only praised the dissent in Roe, Rehnquist's dissent, but he has also, in his writings and speeches, basically said he doesn't see where in the Constitution women's reproductive care is. He doesn't see where our basic human rights and civil rights exists in the US Constitution, because that's what we're talking about. Because without the protections of Roe, it means you're going to criminalize abortion, and it means that you will force women to take a child to term, even if it will cost her life. And if you look at the maternal mortality rates in this country today, which we will talk about specifically, if you are a black woman in New York City today, you are 10 times more likely to die in childbirth than a white woman. And so you have serious issues that we need to address about keeping ourselves safe and alive that this justice will undermine.
Yeah, let's talk about maternal health in the state of New York and across this country. I was here a few years ago at BlogHer to premiere a film a series that we work on at Every Mother Counts called Giving Birth in America, and we focused on New York State at the time. Since that time, we have fallen behind even further. We are currently ranked 30 out of the 50 states in this country. The U.S. is one of 13 countries with a rising maternal mortality rate. We are in a dangerous place right now with regards to healthcare. And as you said, in New York State, in New York City, 12 times as likely for a black woman to die from complications related to pregnancy and childbirth. Now, this is a crisis, and we're also in the state of where is ACA and how are we going to protect what we have in terms of Medicaid and protections for our health care. This is a critical state. Can we talk a little bit about ACA and also about some of the bills that you're working on right now to protect women's health and maternity care in New York State?
Yes, so one of the problems we have in our state is it's the impact of institutional racism, that if you are a woman of color, your likelihood of surviving delivering a child is much, much lower. New York City, 12 times more likely that you will die. This is a real issue of life and death, and it is something that is harming our ability to provide care for women across this country. So I have a bill to create best practices, standardized best practices for maternal health in all hospitals all across America, and fund through grant money the ability to put in place those standardized best practices in all hospitals. Because what they're not doing, and we found this, there was a place in California that decided to implement these standardized best practices, and they took their mortality rate and reduced it significantly. And what it means is you have these kits on hand in the delivery room. So if the mother goes into cardiac arrest, if she begins to bleed out, if she has hypertension, if her body just begins to shut down, all the emergency equipment is there. They don't have to run around and find it because those minutes matter. And to teach the best practices is what needs to happen. So that's what our bill will do. We're going to introduce it soon. Hopefully, there's other bills that have already been introduced, bipartisan bills, to do grant money, to do the research, to actually analyze what is the maternal mortality rate in every state, in every jurisdiction, where are the problem areas and why, and actually document that information so our solutions can be stronger. But it's really important that we put women's health first. And just to tie the knot on Cavanaugh, he doesn't believe that health care is a right. He believes it's a privilege. And in fact, over and over, he keeps putting the free speech rights of corporations over the free speech rights of individuals. And about the ACA said that he thought the insurers had a free speech right to make you pay more if you have a pre-existing condition. So he is a disaster for women's health from top to bottom. And undermining Roe, to complete the thought, again, for women of color. Before Roe, 90% of the deaths that came because we didn't have access to safe legal abortion, 90% of the deaths were women of color. So this is really a life and death issue. The justice, fixing our medical system, and making sure that health care is a right, not a privilege, because it overwhelmingly impacts women in America.
It's important that you mentioned the safety bundles that ACOG and AIM has put out, and they, like you said, they include disparities, they include postpartum hemorrhage.
Tell everybody what AIM and ACOG are, because they probably don't know.
Oh, sorry. ACOG is the American College of OB-GYN, and they are a professional organization, and they, like other professional organizations that involve nurses or midwives or community health, they work together ideally because they're supposed to be addressing maternity care for all. But AIM has been very much focused on this issue, both internationally and in the US. And they've worked with states to provide these checklists, essentially, of what needs to be into place. So, is there a maternal mortality review?
Right.
Are the doctors on board? Are the hospitals on board? Like, in order for these things to succeed, you really have to have all the stakeholders at the table. Exactly. And then you have to be addressing those leading causes of death. And so it's really a great way of getting everybody to be thinking about all of those things, because it's more a matter of preventative. It's like training to prevent an incident that we don't know is going to happen or not. So it just takes dedicated and persistent attention.
Yeah, and that's what our bills would do, would augment what they're already doing and fund what they're already doing, and then standardizing, actually have those standardized best practices across the country.
Right. And then there's hospitals that are closing too. All over this country, we have hospitals that are merging or closing, and so our options for healthcare, let alone Planned Parenthood, are diminishing.
Yeah, and Planned Parenthood is necessary care. Planned Parenthood is basic health care for millions of women and men across this country. And without the protections of Roe, states are literally waiting to make abortion illegal. There are 4 states that are trigger states, meaning they already have the law in place that if Roe is rescinded, that automatically abortion will become illegal and criminalized. There are 7 states that already have statutes in place that limit access to abortion. 4 states only have 1 clinic in the whole state where a woman could go to get abortion services. So what you're really talking about is making health care very hard to access for millions of American women, and so particularly lower income women will be most disadvantaged, because if they can't travel out of state, if they can't get the health care that they need, they might be forced to return to the days pre-Roe, where they take their health care into their own hands, and unfortunately it often results in sterilization or death, and it does not have good outcomes.
Unsafe abortion is the cause of 13% of the global maternal deaths in the world. So it's real, and that number will go up drastically if this were to happen. Another interesting thing that's happened in the news that's related to us and our bodies is we just finished National Breastfeeding Week yesterday. And a few weeks ago, it was reported that the U.S. was one of the only country, I believe, that opposed the WHO's thinking and advice around breastfeeding and encouraging breastfeeding as the most important opportunity to ensure health for the child for the rest of its life. What do you say to that? I mean, this should be something that is not partisan.
So common sense. So it's been widely reported that the reason why the Trump administration was the only country to not want to make this pronouncement was because of the interests of the baby formula companies. So this goes back to this notion of who President Trump is and what his administration does. They are siding with corporate interests, with making money over health and well-being of patients and women around the world. Over and over again, siding with money and greed and for-profit companies over our health and well-being. And that corporatist approach, that making sure that corporate profit is more important than human health is outrageous. And when it comes to our babies and our children, like, you can't tolerate it. You have to speak out. And so a number of senators and I wrote a letter to Alex Azar, HHS secretary, as well as a letter to, who was it? Somebody else. I wrote 2 letters, but the one to HHS basically said, who did President Trump consult with? Did he talk to the baby formula industry? Did he talk to doctors? Did he talk to professionals? How did this statement get written? So that we actually have a real answer on why did he rule this way? I mean, this is a horrible policy, and that we frankly have a right to know about what influenced it. Oh, the second letter was to Nikki Haley, asking her, since this was something that was supposed to be done through the UN, what did she consult? What conversations did she have? With whom did she have those conversations? And we've asked for a full review of the issue. So hopefully we'll get some answers at some point. We wrote those letters in July, and so we have not gotten response yet from either one of them.
Can we talk about family paid leave also? Thinking
Yes.
of
Yes. How many people here would like to have a national paid leave plan?
I mean, this is about keeping families safe and healthy. It's not just about women, right?
Yes.
Even if it were, it would be important. But the thing is, it benefits the entire family.
Right.
And talk a little bit about New York, because I know we introduced it recently.
Yeah. So I think there's 6 or 7 states that already now have statewide paid leave plans. And what I've done with a number of others is write a bill to guarantee national paid leave for all workers. And that means men and women in part-time, full-time, big companies, small companies, gig economy, all jobs. And you would buy into it as an earned benefit the same way you buy into Social Security. So every week you'd put in $2. I would pay $2 a week. I don't know, would you pay $2 a week to have paid leave? I would do that. Pay in $2 a week. It's the cost of a cup of coffee a week. Your employer matches it. Over your lifetime, you'd have more than enough money to take the leaves that you need for all life events. So whether it's a new baby or a sick spouse or a dying parent or a sick child, having that flexibility when you need it will make all the difference. And it really helps the economy, because every time a woman, if she doesn't have sick days, if she doesn't have vacation days, can't meet those family needs and has no paid leave, and only about, it's about 15% of Americans have access to paid leave. It's a very small percentage. If you don't have paid leave or sick days and vacation days, what happens is you either don't meet that family need or you quit your job. And every time a woman or man is forced to quit their jobs, women particularly, when they ramp off, they rarely ramp back on with as much pay and as much seniority. In fact, it's one of the reasons why 2/3 of minimum wage earners are women, because we call it the sticky floor. Because every time you ramp off, when you ramp back on, you're in a lower wage job, lower down on the rung, can't work your way up, and you're chronically in these lowest paid jobs. So if you had a national paid leave plan that worked for all states, for all people in all jobs, you would allow more people, particularly women, to reach their full economic potential, to earn more money for their families, and to continue to move up the ladder. That makes all the difference in the world to have a growing economy. So it just makes common sense, and it makes economic sense. And another thing, we've polled all 50 states. Most states, the majority of all voters support paid leave. So the nation's already there. We just got to get the politicians to catch up to them. But people want national paid leave. And if you don't have it, then only big states are going to have it, and only very wealthy companies are going to have it. Because small businesses, small states can't afford it. And so if you don't provide it for everybody, it's not going to happen for most places.
So another important thing is female leadership. I mean, you have been in this position of influence and power for 10 years now, right? More and more women are stepping up, even though I'm sure you would say it is not easy. It is not easy work. For those of us who are frustrated and don't know really where to focus our attention with an election coming up, with so many people talking the talk but not necessarily walking the walk, how do you advise us to, like, where do we direct our attention? What can we do?
So the most important thing about this moment we're in is that our voices really do matter. Our voices, our votes, our willingness to organize and to protest, it really makes a difference. And what we're seeing since the Women's March, how many people here marched? Did you march? I marched. It was amazing. Since the Women's March, right after the president's inauguration, a lot of women felt they needed to be heard. And so they carried signs, and it didn't matter what your sign said, it just mattered that it was your issue. So you could have a sign that was Black Lives Matter, you could have a sign that said women's reproductive freedom, or clean air, clean water, or LGBTQ equality. It was just that you cared passionately about the issue and wanted to be heard. That activism has continued across the board with turning up to vote in special elections and voting in a lot of these early elections we've had, protesting outside Senate and congressional offices, calling senators' offices, just amplifying your voice through social media and your views. It's also been shown in the number of women that are running, and it's just been declared a pink wave because so many women are running and have won their primaries than ever before in the history of America. It's pretty remarkable that we had over 400 women running for the House of Representatives alone. Great groups like Higher Heights doubled the number of African American women running for office this year. Groups like Emily's List would normally be working with 1,000 candidates. They're working with 37,000 candidates right now. So you're seeing this exponential rise in women who want to be heard, who want to make decisions, who want to change what's happening in this country, and they're putting everything out there, all the risks that they would not have taken previously. They might not have chosen to run, but because of the passion they feel and the determination to change the outcome, they're putting themselves out there in an extraordinary way. And just keep being heard, keep raising your voice, keep being active, make sure you vote, make sure everyone you know and love votes. And if you're not running yourself, find a woman candidate to support, because it really makes a difference.
I think mentorship is so important, and I'm just curious, in your personal story, who that person was that sort of set you on the path that you're on and gave you some of those qualities to be the leader that you are today?
So I was lucky growing up in upstate New York. I had two amazing role models, one in my mom and one in my grandma. And my grandmother never went to college, but was a secretary in our state legislature. And she realized 75 years ago that women didn't have much of a voice in politics. They tended to be support staff, rarely candidates. But she thought the way to be heard is to organize all the women to get involved in politics. And those are the women that went door to door, stuffed envelopes, made phone calls. And as a consequence, she spent 50 years organizing other women to get involved in politics, which really rubbed off on me. I loved watching her. She was so passionate about it. It was how she had an impact on our community. My mom also taught me to dare to be different. It didn't matter, you know, that you were the only one doing the thing you're doing. She was one of only 3 women in her law school class. By the time she was my age, she was a 2nd-degree black belt in karate. She was somebody who really owned her own ambition and did it her way, and that also rubbed off on me. So both my mother and grandmother made me fearless about doing things that are hard and even doing things that maybe no one else has done. But if you want to do it, it's worth doing and it's worth fighting for. I also had a great role model in Hillary Clinton. I think what she did by running for president and putting that many cracks in that glass ceiling was a pretty extraordinary thing. She worked hard, she put herself out there, she took risks, she fought for what she believed in, and I think for all women and girls everywhere, when we see a woman working hard at trying to accomplish what she believes in, it just gives us the confidence that I can fight for what I believe in too. And that's why I think so many women are running. I think they really are understanding that they are the solution. Women are the solution to a lot of these challenges, and it's our voices and our views and our hard work that's going to change the outcome.
Absolutely. Amen. I think we're supposed to open it up for questions now.
Sure.
Are we ready for that? Yeah. Are there mics and things out there? Yeah. Over here? Yeah.
Question in the back.
Hi, good afternoon. I'm over here.
Yes, gotcha.
You had mentioned earlier what's at stake for us with the Supreme Court nomination. What can we do tangibly, like this afternoon, tomorrow, to protest this in a way that will have an impact?
So one of the best things we can do is use our personal contacts in all 50 states. To the extent we have friends anywhere besides New York, it's wonderful to reach out to them. But even reaching out to your New York friends and folks local, because they might have contacts in all 50 states, and they might be really good on social media, for example. And I would use every platform that's available to you to be heard on why this issue is important to you. You have to tell your own story. Why does reproductive health care matter to you? Why does our basic civil rights and civil liberties matter to you? Why do you find it outrageous that 5 justices could decide when and how many kids you're going to have? Why does it make you furious that this judge believes that your boss has a right to say whether or not you should have access to contraception? Those are the whys that matter. So tell your why on all platforms and do it in a way to try to convince people who live in all 50 states to be with you and to fight against this judge. That makes a difference, because when we can really take this issue to all 100 senators, we have a chance of peeling off enough to vote no. But I would just create a 50-state strategy.
Hi, I just want to tell you how much I appreciate your passion and your conviction about this, and I want to remind us that the other side of this is, for reproductive health, is when you're trying to build a family, and these restrictions are being put on over and over again, and you're struggling with infertility, like Gabrielle Union spoke so eloquently about yesterday, those rights are also being attacked and being diminished. And infertility, which is a disease of our reproductive system, we're not covered for it. It's absolutely unbelievable. Right. My question for you is, how can we effectively protest and really be effective about not having this judge get on the Supreme Court?
So I think you need to internalize everything that's been said, all these facts and figures, all this issue, all the aspects of this issue, and fight hard. I think women should stand up. If they're angry, they should be angry. If they're worried, they should be worried. If they're concerned, they should be concerned, and just articulate as aggressively and loudly as you can how you feel and why you think this is dangerous for you and your daughters and your sons and for people across this country, because it's about our passion. If we are not heard in this moment, our rights will be taken away for a generation, no doubt. Do not think this can't happen in America. It's already happened in many states. You have to recognize the status of reproductive freedom in this country are already undermined in other states. You have 4 that will immediately, when Roe is overturned, outlaw abortions, will criminalize it. You have 7 that have already begun to undermine it. This will be exponentially worse when you have a national federal ban.
Hi, ma'am, over here. Oh, hi. Hi, my name is Anne Marie. I actually live in DC. I'm a New York transplant, though. I am a senior, okay, I don't want to shout into the mic. I'm a senior advisor in the federal government, and just for everyone here, there are a lot of career federal.
We can hear you, so keep going. We can hear you perfectly. It's in your ears.
Feeling it. There are a lot of us that see a lot of bullshit every day, but we stay because we have to be the light in the darkness. There's so many of us that joined the federal service because we wanted to change things. And it's hard, but thank you for doing things like this, because I didn't mean to cry, but I'm fairly high up in the level, and I see a lot of stuff that everybody else doesn't see, okay? So everybody here, you have to continue to resist, okay? It's not up to the people that work in the federal government. It's up to everybody else here. We can only do so much from where we sit, okay? People talk about the government in general as if because Trump here is this evil thing. There's so many good people that want to make things great for every one of you, but we are where we sit, okay? So don't fall asleep. Don't think that the wall is not happening, because it is happening. Don't think that all these things aren't happening. They are happening, and many of you are being distracted by fucking tweets, by Instagram, by these other things that don't matter, by Manafort. Focus on the issues and don't take your eyes away. When something important is happening, a distraction comes up and you take your eyes away. And that's how apathy starts. We get sucked in this social media vacuum. Screw it. Change the world. So on that note, ma'am, I will change my driver's license back to New York State. If you have any openings, that'd be lovely. I would love to work for you. I'm a seasoned senior advisor with over 12 years of federal service. So that's one. Number 2, should we look for you in 2020?
Well, let me start by thanking you for your service. It is really hard when the President of the United States condemns every piece of work and effort you do every day, constantly condemning the public service you've done for the last 12 years. And it's outrageous because you are literally serving others with every minute of your working life. So thank you for your gift of service, and thank you for speaking out. The emotion, the raw emotion that you shared is what all of us should share. Because if we don't fight, our lives are at risk. This is literally what's at risk. The lives of women everywhere is at risk because of this president. And so do fight like your life depends on it, because it does. So you're quite right. And my staff, Glenn Kaplan, will go get your business card. So thank you very much.
I think we have one more.
All right, that's a tough act to follow. I'm very emotional too, and I got up here because I am very angry. I am a born and bred New Yorker who moved to Nashville 3 years ago, a city with a female mayor that's gone through some stuff, if we know about that. A city that's a blue city in a red state. A city that has opened my eyes to privatization of healthcare in a way that I never understood before. So I'm really confused. I was a jaded New Yorker, if you will, right? The stuff we hear all the time. And I really want to trust my government. I really, really do. My dad's a veteran. My dad voted for Trump, you know? And I sit across the table from him and we have productive dialogue. We don't argue, believe it or not. I didn't defriend him. And so I'm really, I almost thought about it, but I'm very, very confused about 2 things. Number 1, if this doesn't go the way we want it to go, do you think there's a privatized solution that may come into play, or something that might, you talked about Medicaid before and things like that. I mean, you look at the limits to enter Medicaid for millennials, right? We're talking about a market of all of us who work as influencers, right? Work as like freelancers, basically, or chasing paycheck to paycheck to paycheck. And we are on that same track as a lot of people that we talk about, but we don't admit it. So are there solutions if this doesn't go the way that we want it to? I don't know if I'm even asking a question. I am so emotional right now, but
On
I hope you're getting my point.
specifically, or ACA?
Sorry, what?
On choice or the Affordable Care Act?
Affordable Care Act is really what I'm...
So what President Trump is doing is trying to unwind it. He's already taken away the mandate, which will mean it will fail eventually. He is considering a judge who, as a justice, would put corporation free speech rights over your free speech rights by saying that insurance company can charge whatever they want if you have a pre-existing condition. So it will make healthcare unaffordable for millions of Americans. So I believe healthcare should be a right, not a privilege. I believe we should fight for Medicare or Medicaid for all. I think it would make a huge difference if we had at least one not-for-profit public option. I think if you could get this country to a place of single payer, you'd get to affordable, accessible, quality healthcare for all Americans as a right, not a privilege. But we should talk about why even just introducing Medicare for all to say anybody can buy in at a price they could afford is an amazing way to get to that shift. And so I think we should just be for what we're for and just talk about healthcare as a right, not a privilege. And there's 4 or 5 good ways to get there. But President Trump has no interest in making healthcare available to all Americans. He wants people to be denied healthcare because they're too expensive. They don't care. They don't care. Their first obligation, well, under corporate law in America today, their first obligation is to their shareholders. It is not to their patients. So I have a lot of ideas how to work on that, and that's reimagining the economy in a way that is more focused on how do you build a strong economy for everyone and how do you build a strong middle class. And maybe, you have for-profit companies that now get a 22% tax rate, and you have not-for-profit companies get a 0% tax rate. Maybe you have a common good company that gets something in between. Maybe you have dual mission companies that say, not only are we for profit to our shareholders, but we're also for putting our patients first. Maybe you begin to have drug production in the not-for-profit sector. So you can actually take on the drug companies who are constantly either price gouging or raising their rates or manipulating the market because they are entirely dominated for some of these companies by greed. And so the truth is, if we don't take on the drug companies, if we don't fight for Medicare for all, we're not going to have affordable quality health care for all Americans.
We are out of time. I know we could talk to you all day. Thank you so much. Thank you for your service, for your leadership, for being here with all of us, and for keeping the fight. I mean, we watch you, and I admire you because I know it's hard work, and we are still here, and I am behind you, and thank you so much for your
Well, thank you, Christy, for your leadership and your voice. It makes a huge difference. Thank you.